Heart attacks and strokes are two of the more serious events that can result from untreated vascular disease. Coronary artery and vascular disease are the #1 killers of men and women. Early detection can save lives. Joining us to discuss vascular screenings that can spot problems early, Dr. Steve Gubin from the Stern Cardiovascular Foundation. And doctor, welcome to Smart Medicine's Heart of the Matter.
Thank you.
It's a delight to have you here today. Now let's start by defining some terms here. What is the difference between coronary disease and vascular disease?
Well, vascular disease is atherosclerosis, the buildup of cholesterol and fat, not only involving the blood vessels of the heart or coronary artery disease, but also the peripheral arteries, which are the blood vessels outside of the heart. 20 to 30 million Americans are at risk for vascular disease.
Quite a number.
Quite a number.
All right. Well, how can you find out if you have vascular disease?
Well, vascular screening tests are simple, painless, non-invasive tests used to identify patients with atherosclerosis, which can lead to heart attacks, stroke, aneurysms, and also impaired circulation to the extremities.
What are the risk factors for stroke or heart attack?
Well, risk factors you can think of as modifiable, non-modifiable. Non-modifiable risk factors are risk factors that you can't do anything about, such as aging and a strong family history. Modifiable risk factors are risk factors in which you can change or at least improve, such as cholesterol, blood pressure, diabetes, smoking, sedentary lifestyle, or obesity.
Well, what type of tests are included in a vascular screening?
At the Stern Cardiovascular Center, our panel of tests includes blood pressure, weight, a measure of the BMI, which is body mass index, an EKG rhythm strip to make sure that you're in rhythm, an ultrasound of the arteries in your neck, the carotid arteries, to see if you're at risk for a stroke, an ultrasound of your abdominal aorta to see if there's evidence of an aneurysm in your stomach, evaluation of the circulation in your lower extremities. We use what's called an ABI, or an ankle brachial index, as a marker of peripheral vascular disease. We also get a cholesterol profile and a high sensitivity C-reactive protein, which is a marker of inflammation, which has been associated with heart disease. And also you can get a heart scan, sometimes called a calcium score, that looks for calcified plaque in your coronary arteries, which is also a marker for atherosclerosis.
Sounds pretty comprehensive there.
Very good.
Well, who should undergo vascular screening?
If you're between the ages of 40 and 70 and you don't know that you have heart disease or coronary disease or vascular disease, you should probably undergo screening. If you have a strong family history, a mother or sister who has heart disease less than 65, or a father or brother who has heart disease less than 55, you should undergo screening. If you have a history of diabetes, smoking, high blood pressure, you should probably undergo screening. If you live a sedentary lifestyle and don't exercise on a regular basis, it'd probably be a good idea to get a screening.
Well, I know you play tennis and you're a runner, so I know you don't have that sedentary lifestyle. What kind of information are you looking for from the screening being done at Stern? What are you looking to learn?
I'm just trying to see if patients are at high risk for a vascular disease.
And how much do these screenings cost?
Well, the purpose of these vascular screenings is actually to prevent a cardiac event. We've made great strides in treating cardiovascular disease, but the best form of treatment is prevention. The cost of these studies, the screenings cost $199 plus an extra $49 if you get the heart scan. So I wouldn't wait. I'd call and schedule vascular screening. You can call area code 901-271-4192.
And it's that simple. And so for a maximum of $250, you can find out the answers.
Yes.
Well, Dr. Gubin, I know a lot of people have taken advantage of these, and you do them right there at the office.
Right. I'm proud to say that over the last 2 years, we've screened 461 patients, and only 4% of the 461 were completely normal. 48% of the patients that got a heart scan were abnormal, and of that, 28% of those had a calcium score greater than 50, which is consistent with a moderate amount of plaque. 2 of our patients underwent coronary intervention, either with an angioplasty or stent, and 1 patient had to undergo coronary artery bypass grafting.
So 4%, only 4% were found to be completely normal.
Completely normal. We were always able to find something that can make the patients healthier.
All right, well, Sounds like good advice to get this checked out. Dr. Gubin, thank you very much for being here with us on Smart Medicine's Heart of the Matter.
Thank you.